live today. So today we are having this video series on Baby Chakra app in collaboration with Baby Chakra app. If you've not downloaded it, you can download the app with my referral code using Nehal S. And please download the app and watch me live. So today I'm going to talk about thumb sucking habit in children. So if you're watching one of these live session, if you're watching one of the live sessions today, it possibly tells me that you are one of a concerned parent. You're concerned either about a oral habit in your kid, or maybe you're trying to stop the kid from the habit, but you don't know what to do, what's right, what's wrong. So don't worry, you're at the right place. I'm here today to walk you through the in and outs of the thumb sucking habit. So I'm Dr. Nehal Sanghani, and let me share my screen with you. So now this is the session on thumb sucking habit. As I told you, I'm Dr. Nehal Sanghani, and let me give you a brief introduction about myself. So I have completed my graduation and post graduation from Bangalore in the year 2014. I am a periodontist and a implantologist. Basically, I treat the teeth and the gums surrounding the teeth and the diseases of the gums. And I have also pursued my fellowship in aesthetic dentistry from in 2015, and after that I have worked as a, periodontist and a consultant periodontist in various clinics in Bangalore as well as in Mumbai, and a corporate chain of clinics at Bombay. And after that I've opened up my own private practice, and I practice at the heart of Mumbai, that is at Juhu, by and I have my multi-speciality clinic by the name Pristine Smiles Dental Care. I have a special interest towards laser periodontal surgeries or the gum surgeries, and cosmetic dentistry, teeth whitening, as well as dental implants. So my clinic is a one-stop place for all your advanced treatments, and we follow strict four-step sterilization protocols, wherein all the instruments are untouched, and they are open only when they by a human gloved hand, and when they are about to be used in the patient's mouth. And we also provide teeth whitening services with the most advanced system, that is Zoom. We also have implants and laser, painless laser surgeries, and digital radiographs incorporated in our practice from the very first day. Okay, so this is some of my cases, cosmetic cases which I have done, and also we have had the privilege to treat a lot of TV actors and celebrities at our clinic, and also I provide home visits for the senior citizens and who are bedridden. And yes, we also have, and we love treating kids. We have a lot of kids at our practice. So this is my email ID and our contact details. And you can also follow us on Instagram and Facebook. And I've shared the social media handles over here. And this is our clinic picture. So now let's talk about the thumb sucking habit. So, what are we going to talk about in this session? I'll make sure that this half an hour is worth your time. So, first thing we are going to learn is it really a bad habit? Is it really worth all the hype about this tongue sucking habit? What's normal? What's abnormal? Secondly, we'll try to understand what's the root cause behind the habit. Why and when should you stop or intervene? And what are the effects of thumb sucking? Practical and effective methods to stop the habit, and what's the role of a dentist in habit breaking. So let's jump in and start. So as we all know, infants or babies, they have a natural tendency to suck. All the babies are born with two reflexes. One is the rooting reflex and one is the sucking reflex. So now what's rooting reflex? So this rooting reflex, it encourages the baby to latch on to latch on to nipple of the mother. So whenever an object is touched or touched to the cheek of the kid moves, the baby moves in that direction, and the baby opens the mouth. This is the thing but rooting reflex. And next is the sucking reflex. So sucking reflex is nothing but whenever an object, or maybe baby's fingers or any object which is touched at the roof of the mouth, This is the baby closes the mouth. So this is the sucking reflex. So now, what is thumb? What is the role of this sucking reflex and thumb sucking habit? So it is said that the thumb sucking habit is a prolonged extension of the sucking reflex. So now let's understand what's thumb sucking. Thumb sucking is nothing but placing the thumb or one or more fingers at various depths in the mouth. Okay. Now, what if I tell you that thumb sucking habit is absolutely harmless? Yes, you heard me right. It's absolutely harmless, but at a certain age. So, if your infant is addicted to this thumb sucking habit, then there is no need to stop the habit. In fact, it's proved to be beneficial in children. Why? Because it acts as a natural reflex for the children. So it is a deep, it's a prolonged extension of the rooting reflex or the sucking reflex. So basically, the baby sucks their thumb. It usually begins at the age of 2 months and stops by the age of 5 to 8 months in most of the kids. In 70 to 80% of the kids, this thumb sucking habit extends up to 2 to 3 years of age. So up to this age, up to 3 to 4 years of age, you need not intervene or stop the kid from this habit because it's beneficial. So if your kid is having thumb sucking habit, be happy that they will be less fussy, they'll fall sleepy immediately. So because the thumb sucking habit, it helps them, it provides them a soothing mechanism or a coping mechanism, because there are a lot of changes going on in the kid at that age. So they are undergoing a lot of milestone developments. So it keeps them secure, it releases happy hormones in the kids, and also they soothe themselves and fall asleep easily at their thumb. But does it get worrisome at any time? Yes, definitely it gets worrisome. Now let's understand, when does it get worrisome. So if this habit prolongs and it extends beyond 4 years of age, or when the permanent teeth start erupting in the baby's mouth, then it is worrisome, and that's when you need to intervene and stop the habit. Now let's understand why. Why does the kid get addicted to thumb sucking? Now, first we need to identify what's normal and what's abnormal. As I've explained, up to age of 2 to 4 years, it's absolutely normal. Do not stop. Most of them, uh, they let go of the habit on their own. You never see a school kid walking with a thumb in their mouth. Okay, so need not worry. As soon as they reach they start going to the school, they will automatically leave the habit. And what's abnormal now? So when it's abnormal, it can be due to two causes. One is psychological causes and one is habitual causes. So now psychological causes, they have deep rooted psychological reasons behind them. So we need to figure out what is the reason. I'll discuss about them in the coming slides. And next is the habitual. Habitual are basically empty habits. So they don't have any psychological roots. So like maybe when the kid is bored or when they are watching tvs or long videos, then they subconsciously perform this habit. So other factors, why other causes of why they suck their thumb are, sometimes they have other kids who suck their thumb, so they like imitating them. And sometimes it's because of feeding issues, so maybe they are not fed well, or they are inadequately fed. That's when they perform this thumb sucking habit, which acts like a coping mechanism. So when the baby is still hungry, then he or she starts sucking their thumb. Then there are certain emotional or social causes. Emotional causes may be, maybe if both the parents are working and the kid is not getting enough love, affection, then he resorts to this coping mechanism. Also, if there is an younger sibling which has just arrived in the family, and the older sibling is not getting enough attention or love, that's when they try this mechanism in a way of attention seeking from the parents. Okay, so first we need to identify the cause so that we can treat them accordingly. Now, when should you worry? So as I told you, If in the there are three phases in the infancy, up to 3 years of age, that is the preschool. Till the preschool age, it's absolutely normal. Never stop the kid and never criticize them, never use harsh words for them. uh, they will automatically stop. 70 to 80% of them will stop the habit. About 3 years of age, you need to start your intervention. That is, you need to constantly give them reminders or gentle reminders that don't put the thumb in your mouth. Then above 4 years of age, you need to follow strict habit breaking methods and start intervention immediately. Now let's talk about what are the effects of thumb sucking. So because of thumb sucking, there are various effects. We usually are aware only about the malalignment or bunny teeth, or which usually parents are worried about. My kid is having thumb sucking, so he'll have crooked teeth or bunny teeth. But that's not the only issue. There are several other issues which are usually neglected or often ignored because they're not commonly seen, but they are very serious. So some of them are bacterial, viral, or fungal infections. So because kids are playing throughout the day and they touch a lot of objects, and they are crawling on the floor. So if the environment is not clean and tidy, then those microbes may enter the kid, and kid's thumb, or even enter the stomach and causing stomach infections. There, one frequently found infection is the fingernail infections. It's a kind of fungal infection called paronychia, wherein the barrier between the nail and the skin of the thumb of the finger is broken, and because of that, the fungus enters and creates an infection. And also, we have found a lot of speech difficulties in the kids. Usually, they have difficulty in pronouncing T and D's. There's mouth breathing, then changes in the neck posture, tongue thrusting, that is pushing the tongue outside, and lots of effects on the development of teeth and jaws, especially beyond the age of 4 years, when the permanent teeth are growing and the jaws are developing. And if the habit is continuous, is prolonged, then you see these effects on the teeth and the jaw. Now, the effect on the effect of deformity on the jaws and the teeth depends on three factors. One is how long the baby is sucking the teeth, sucking the thumbs, and how frequently it is, how for how long, how frequently, and what is the intensity. Is it very passive or is it active and vigorous thumb sucking? So that needs to be determined. So now, in cases where it is, so how do you identify whether your child is having an active or passive? So now, if the thumb is inside the child's mouth, you gently try to pull the thumb out. If it comes out easily, then it's an empty habit. That means it's just out of boredom, or there must be some trigger which makes the child suck the thumb. Okay, so you need not worry. There might not be major changes in the jaw deformity, and you just need to apply some reminder methods to stop the habit. And if it is vigorous, then when you try to pull the thumb out from the child's mouth, they resist this and it gets difficult. That means the thumb sucking habit is very active. So this, in this cases, there are vigorous and gross deformations seen in the jaws, as you can see in these pictures. So now it results in open bite. So what's open bite? When the child bites on the teeth, the back teeth, the front teeth remain always open. So that space is called as an open bite. So the front teeth do not contact each other. So because of this open bite, what happens is that this space, so that child tries to push the tongue in between. So this in turn results in secondary habit, that is the tongue thrusting. Also because of the pressure. So what happens, as you see in the lower diagram, whenever the child is sucking the thumb, they push the upper front teeth forward, and they make them protrusive and spaced out. Okay, so now what happens? The teeth become flared and spaced out, and the lower teeth. So there's pressure, upward pressure on the upper teeth, and inward pressure on the lower teeth. So the lower teeth, they start tilting inside. So usually the upper and lower teeth start crowding, and that's when kids start teasing them as bunny teeth or like rabbit teeth. Okay, so now you can see in this image the teeth are jetting out in this here second image. As I explained, so this is the secondary tongue thrusting habit, and you can see the upper arch, the upper jaw becomes very narrow, and you see the teeth jetting out. That's because of the forward pressure by the thumb. So these are the effects on the thumb sucking habit on us. So if this goes on beyond the age of 6 years, then you need to the deformity is so gross that we need to begin orthodontic or braces treatment for the kids, and usually they are very expensive and complex. So it's best to intervene at the earliest stages. Now coming to the most important topic, that is the quintessential tool. What should I do or to break the habit? Now I call it as thumbs up for the thumb out. So first of all, first thing is don't stress out. Never get stressed. So most of them get comments if their child is having a thumb sucking habit, and one of the relatives or friends points out, and the mom usually goes into a huge guilt trip. So there's nothing to stress out. If your child, as I've already mentioned earlier, if the child is below 5 years, 4 years of age, need not worry, they will stop. But you have to give your child a chance to stop. They are willing to stop the habit. First, you have to make them aware that they are having this habit. So habit awareness is important. Create that habit awareness. So how do you create that habit awareness? I'll talk about it. So when you give them a chance to stop the habit, that's when they become equally involved in quitting the habit. Okay? So what you can do is, first is track how long are they sucking the thumb, when do they suck the thumb. There are usually visual cues which the baby gives you or the child gives you when they are sucking the thumb. So you try to observe them. Try to check when do they do it. Do they do it during the daytime, or is it only during the nighttime when they go to sleep, or is it during like stressful situations, or when you get angry, or when you shout at them. So you try to observe the emotions around that habit. Next is you find out the underlying triggers. Like usually babies have an underlying triggers, like if they are hungry or they get sleepy, they're bored, they have a fear of some object, or they have fear of something about you, then or they get angry, or they sense some change in environment. Maybe so kids at that age, they are undergoing a lot of changes and stressful situations, like you put them into daycare or you put them into a preschool, and that's the first day or the first few weeks. So they do not like the change in this environment, and that's when they find a coping mechanism. So usually thumb sucking is like a security blanket for them. That's when they cling on to this habit. Okay, so you have to find out the underlying trigger and understand what triggers them. Then, whenever you try to start about breaking the habit, you have to tell the first provide a substitute for the habit. So, baby usually comforts to the thumb sucking habit as a it's a pleasurable or a comforting activity for them. So, provide an equally comforting substitute for that activity. Like you provide them a stuffed toy or a soft blanket or a stress ball. Okay, and then you ask them to leave the habit. Then distracting activities. So whenever they are engaging in thumb sucking activity, you distract them by maybe like puzzles, or engage them with some fun activities like coloring or blocks, or whenever you're doing engaged in some daily chores, then try to engage them in their chores also. And next is sometimes when the habits are empty, like maybe if the kid is not aware that they are sucking the thumb, you constantly give them a gentle reminder, or make them stand in front of the mirror so that they can observe how they look when they are performing the habit. Never criticize, scold them, or use harsh words to stop them. And one important thing is positive reinforcement, that is, praise when they stop the habit and punish them when they repeat. Punish by this, I don't mean that you have to use harsh words or get angry on them. So, punish in the sense, you know, this is their favorite toy. So, when they indulge in that habit, you tell them that I'm taking your toy away from you because you indulged in this habit, or refrain them from seeing their favorite cartoon or their screen time. counsel and ask them why they do it, show the effects of the habit or the videos or YouTube videos. You can show them about uh, what happens when they continue this habit. So in one of my patients, the parents were very worried. They tried all these methods, but they were unsuccessful. So what I told them is just tell them that if you continue sucking your thumb, then you will have a teeth like the camel, like you can see exactly in the picture. And when the kid saw that, he never wanted teeth like that, and he immediately stopped it within a week. Then next important thing is the progress charts or tracking charts. So you set realistic goals along with your kid. Okay, always keep them involved in this actively so that their willingness to leave the habit is multiplied. So set goals and give them rewards on completing the chart. I will share you the chart picture of the chart. So you can tell them that if you suck your thumb only for 15 minutes today, then you will get a star. So you can give them stars or their favorite cartoons or your stickers, and once they continue it for a week, then you can reward them with a maybe their favorite game or maybe their puzzle or movie. Okay, then the positive, this is nothing but positive reinforcement. So introducing a desirable stimulus to encourage a certain behavior. So example, if you don't suck thumb while watching your TV, you get a new toy today. Okay, then older methods were applying bitter tasting substances on, they were painted on the nails like neem oil, famide solution, which is available at your local chemist. Also, you can mix paste of milk and mint and apply it on the thing. Then you can do restrictive barriers like thumb guards, which are, I'll show you pictures, customized or silicone with holes. Also, you can provide thumb sleeves. Another method is like their night gowns. You can extend the sleeves and make it long, extending till their fingers. Then you also give them elbow splints. And if all of them fail, then you can visit your dentist. They will provide you the habit breaking appliances. Okay. Now, the formula to remember this is first is track, then distract, then engage them. So remind them that they have to stop and then reward them when they stop it. Okay. So this formula always works. So these are thumbsies. So they are like if they are sucking the thumb and the first finger, you can extend it to that. Or if they are sucking only the thumb, then you can use these thumbsies. So you can get them customized or from the material like their favorite cartoon or the superhero. Then you have these T guards or the thumb stops or the thumb guards. So they are made silicone covers which are tied to the wristband, and you can also put adhesive band-aids of their favorite cartoon characters on the thumb. And then this is the elbow band, which is called as nippet band, which is popular in the US. So here and band is restrictive band is tied to the elbow so that the kid cannot bring the thumb into their mouth. Okay, so they can bend the thumb only up to a distance, so the thumb cannot reach the mouth. Then you can also use this the puppets of their favorite cartoon characters or the family members and put it on their thumb. And this is the famide solution. So your pediatric dentist or your dentist will be able to tell you how to use it. And these are the rewards. So now you can track them like for the week, and you can write there, I'll not suck my thumb when I'm away from the home. And you can give them stickers to track, or you can put up a race or a milestone on the way towards a journey of 1 month of um, habit tracking. And whenever they complete a week, then or achieve one milestone, you can reward them at those stages. And now to the role of dentist in habit breaking. So when all these resorts fail, most of the times giving them enough attention, love, more playtime or cuddles usually works best. And counseling them, talking to them, ask them what's wrong in their behavior or what they don't like about you. And this communication usually works. And if all of them fail, so if it's a deep rooted psychological habit, then you need to seek the help of a dentist in breaking this habit. So the dentist usually make customized appliances. They can be either removable or fixed to your child's tooth. They usually worn for around 6 to 12 months, and once they are worn, they can be removed by the dentist. So they usually consist of metal wires which act like a trap, okay, for the thumb. The dentist usually aims at making that comfortable or pleasure-seeking activity of thumb sucking uh, an uncomfortable act by placing barriers at the roof of the mouth. Okay, in this way, they also prevent the malalignment of the teeth, and also the thumb sucking activity, which was a pleasure or gratification activity for the kid, now becomes very uncomfortable and unhappy thing for the kid. So now you can see these most common appliances are the quad helix bluegrass appliance, wherein a wire plastic roll or a bead is mounted onto a wire. Now the kid, what happens is it they tongue engages the roller and they start to play with it. So because of this engaging or distraction, they forget that they have to keep the thumb inside the mouth. Then you have palatal cribs. So they act as barriers. So it stops the thumb from going inside the depth of the palate. These are the several appliances. So basically, it allows in proper development of the upper and lower arches, restores the tongue position. So they have, because of thumb sucking, just that position, resting position. So this can be altered because of these devices. And also because of the thumb sucking activity, their cheek muscles, tongue muscles, and the chin muscles become hyperactive. So this imbalance is restored again by the use of appliances. And also it prevents malpositioning of the front teeth, improves chewing and speaking functions, and boosts the confidence and self. I hope I was clear. Thank you all for your patient hearing. And if you have any more queries, feel free to drop in your questions at the mail ID I've provided here, or you can contact me on this number. Thank you, Baby Chakra, for providing me this platform so that I can share my expertise with all the young parents. I hope the session was helpful. So if you have any questions, you can ask. So thumb sucking usually starts by the age of 2 months, and in 70 to 80% of them, it stops by the age of 8 to 10 months. And in some kids, it prolongs up to the age of 4 years. So 2 to 4 years is normally the age where it should stop. What can I do to encourage my child to stop thumb sucking? So, first is the positive reinforcement. First, figure out why he is doing it. Try to see the visual cues that the baby is giving you. Check the underlying triggers. Like, is he doing it only at the night time? Maybe because he is finding it difficult to fall asleep. That's why he resorts to thumb sucking to make it easier to fall asleep. And if it is during daytime, maybe is it because he's hungry, or is it because he's getting bored, there's no one to play around it? Just provide him enough love, attention, some more, increase your cuddle time, increase your play time with the baby, and all this encourages them. And also provide distraction. So if you engage them in fun activities during the day, or in whatever work in your daily chores, then you can also engage them actively, and this will help the baby to be distracted and find lesser time to be alone. My child does continuous thumb sucking before sleeping and after sleep as well. Please suggest. Okay. So now, if it is before sleeping, if it's before sleeping, then basically he is finding it difficult to fall asleep. Try to provide a soothing environment for the, like maybe you cuddle with your kid, or you play with the kid just before it's a sleeping time. And also you can check if he's full, if his stomach is full, if he's feeded well before he goes to sleep. And after sleep, if he's continuing, then that what is the age of the child, I want to know. So if it is after sleep also, that means during the sleep cycle, then it's a psychological issue. Can I know the age of the child? 7 months. It's absolutely normal. Okay, no need to stop them. It's absolutely normal at 7 months. They will stop this activity by their own. Yes, thumb sucking is a natural habit. So basically, it's an extension of your sucking reflex or the rooting reflex. If it extends in the school going age, that is when the permanent teeth erupt, then it's needs to be stopped. Then it's not normal. So above 4 years of age, you need to start your intervention. What age does thumb sucking become a problem? So usually at the age of 4, so that's when all the milk teeth have already arrived in the mouth, and it's a stage where the permanent teeth start to develop and the jaws start to develop. Okay, so beyond 4 years, so at the age of 4 to 5 years. So if it's a passive habit, that means there is no active movement of the cheek muscles, chin muscles, or the lip muscles during the thumb sucking activity. Then when the child quits the habit, then there will be no deformity. And if it is active, then after 4 years of age, then there will be severe deformity. Then it's not normal. Side effects of thumb sucking, as I've already mentioned. So there are a lot of middle ear infections also, which have been recently observed. Stomach infections, viral, bacterial infections, then speech problem, because the anterior space, there is an anterior open bite. So the child tends to start mouth breathing, which is not a natural habit. The child has to breathe through the nose and not through the mouth. Okay, so it develops the mouth breathing habit. Speech problems, they cannot pronounce t d, words with t and d. And also the alignment of the teeth, crooked teeth, then teeth, the lower teeth becomes inwardly placed. Then you also have jaws which become narrower, so which are normally u shaped, they become v shaped. So jaws become narrower. That's why the teeth start protruding outwards. How do you cure thumb sucking? So I've given you a list of tips. So first is you track them, you distract them, you engage them in fun activities, and reminder therapy, positive reinforcement, rewards. Does thumb sucking affect the bite? Yes, definitely it affects the bite. If it is vigorous, if the depends on the intensity and the frequency. If the kid is doing it only during sleep hours, then it's not, the effect is not that great on the development of the jaws. If the kid is doing it throughout the day, maybe for around half an hour or 15 to 20 minutes, multiple times during the day, and he's actively sucking the thumb with a negative suction which is built up inside the mouth, then definitely it has bite problems. Your bite is completely disturbed, you might need to even have orthodontic treatment at later stages to correct that bite issues. So it's best, the earlier the habit is stopped, the better the chances of the bite getting corrected. Okay, so my takeaway message is do not, if your child is thumb sucking, do not go into that guilt trip. Give them some time to break the habit on their own. If not, then You already know what has to be done. It's always never use harsh words, negative or criticizing comments for them, that you're a bad boy because just because you're thumb sucking. Never use those negative words. Always be gentle and have a calm approach. And rewards and reminders always work. Okay, track, engage, distract, remind, and rewards. This is my takeaway message. Any more questions? Okay, thank you guys, and thank you, Baby Chakra. So all of you can follow my Instagram page for more updates on oral health. Thank you, everyone.